The community health centers in 2025 served about 200,000 folks. That was before the whole ICE situation. Out of those, 21,000 took advantage of the specialty care services that Valley Medical Center provides. And this has been going on for many years, by the way, because of our relationship to EMC and the partnership we have with them in the specialty care arena. We started out by looking at the UIS data that we have, and many thanks to James and to Brian Darrow and Valley Health Plan for getting us the data, and it's worse than we thought. The impacts HR1 on indigent, uninsured, and UIS patients is catastrophic. I see it as inhumane. Honestly, it goes against federal legislation that HRSA had put together back in the 80s under Ted Kennedy, and that included the 330 grants, which have been coming to us for many years, and to the clinics. It's one of the benefits of being a federally qualified health center. That money was often utilized to help those that did not have coverage and that they had no other option. And that's a very, very serious concern. Along with that comes the concern of the reimbursement model that the federally qualified health centers, which again includes the county because they also have federally qualified health centers, and that methodology, which is sort of a combination of a state and federal, but mostly state, is set to sunset at some point in the near future. So when you add the 330 grant removal plus the PPS, it's called Prospective Payment System. Assemblyman Clara, we're asking for a couple of things that are huge. One is to ensure that the CalSOS program remains. CalSOS is a data system that has truly helped us enroll folks, renew their applications, and keep track of where they are with their Medi-Cal. The fact that there's now going to be a biannual enrollment system, if CalSOS goes away, we go back to pen and pencil. It is not as well known that that piece is in danger. Like the county, our community health centers must serve everyone regardless of health coverage or ability to pay. We anticipate the demand for care at our health centers will only increase due to the reductions that we talked about and the loss of the PPS system. I wanted to share with you a couple of examples of the additional services that the community health centers provide besides primary care. Child development services, chiropractic, community outreach, dental health, enrollments, healthcare enrollments, housing referrals, specialty mental health, which I think will be discussed later, wellness and prevention, which is often not reimbursed by anyone, so we often use the 330 grant to do that, and nutrition counseling, which is often not reimbursed by anything. Not only do we lose the primary care piece, we lose the other services that address the social determinants of health. I have some data that I'd like to share with our state assemblyman, and you're not going to like the data. The California Primary Care Association helped us pull this data together for today. In Assembly District 25, Assemblyman Clara, California Primary Care Association estimates that your district has approximately almost 42,000 UIS population, half of them being served by community health centers, which equates to a loss of $14 million to start with in revenue in 1 year. Assemblyman District 26, Mr. Patrick Aarons, estimates that the district has a little bit over 22,000 UIS, with over half of them being served by community health centers, and that equates to 7.5 million. We know half of the data. The other half are probably private community clinics. So those may or may not be part of the CPA. So you can possibly double the amount. For Senatorial District 15, Senator Cortese, we estimate that the district has a UIS population of almost 34,000. That equates a loss of $22.6 million. These conservative numbers only reflect losses by CPCA member health centers. Individual health centers who are not members of CPCA are not in this data. We respectfully ask that you do whatever you can to enact state funding measures to protect all of the residents, especially the indigent, the uninsured, and the UIS population.